Like when we want to talk about diabetes and that type of thing, I have to go back to my own personal experience with that. I was diagnosed with diabetes a few years back, and my experience with that was eye-opening. I used to sit and I would listen to the older generation speak of diabetes, and long ago there wasn't as much as you see today. The older generation had it, and you wouldn't hear, or it's very seldom that you heard of our younger people getting it. But I also remember conversations with our older people, and they would say, this young person has diabetes. And then they would say there's more and more of it coming.
So the way that I usually explain it is that sugar is like a body's gasoline, that it is a fuel that is burned by the body. When those blood vessels are burned, again, they scar, they narrow, they're prone to breakage, can cut off blood supply to parts of the body. So then that's how we end up seeing things like, again, the blindness, heart attack, stroke, kidney disease, amputations.
The elders tell us that chronic diseases in Indigenous communities are symptoms of the colonization that's taken place here. People used to be healthy. People used to live a strong way of life where diabetes was virtually non-existent.
All those animals, birds and fish that they ate came from Mother Earth, and those species, they all ate off the land, which means that they had the medicine in them, that we would partake the fish, the birds, the animals, and we would be healthy because they were sharing the medicines through their food.
What we're noticing about type 2 diabetes in children is that when kids have diabetes or prediabetes, it's progressing a lot faster to complications than it does when adults get it. But with children, for some reason, it's a different disease, and that tipping point is happening a lot earlier. And so we're seeing kids, as soon as they have diabetes, they're progressing very quickly to heart disease, to kidney disease, to all the other complications of diabetes. And it's very serious. In this province, Manitoba has the highest rate of child diabetes in the world. 15 years ago, Manitoba had the highest rate of child diabetes in North America, and today it's the world. This is so serious. And if you go to Children's Hospital, to the dialysis ward where children are already on dialysis from diabetes, the majority of the children on dialysis in Manitoba are First Nation.
As somebody who, I was born on the res, I have watched diabetes and chronic disease tear apart my own family. My cookum died before I was born. My dad was one of 14 kids. Now it's only him and his sister that are surviving. I think one of the things that is so incredible about this project is the way in which it is truly holistic. It's looking at trying to identify these early signs of physical disease, and then connecting people to resources to try and improve their physical health, but also to try and improve other aspects of that health, of their health, so that they have more resources again to try and walk along a journey of healing.